So today is date is 0207 and today is Monday. Usually Monday we talk maternity and Tuesday we talk pediatrics and Wednesday psychiatry and Thursday we talk about the case studies. So as I told you, this week is the last week with you, and then we will forward you or we will allow you 2 more weeks for community health and leadership, nursing leadership, 2 more weeks. And beside this or after this, you are able to join in our clinical rotation. Basically, our clinical rotation, you can join in simulation lab at our school in Miami Garden. In simulation lab, we have a very skilled expert RN and LPN. She can help you to learn the materials what you used to will get in hospital. Also, beside of this, you are able to join in our clinical site. Because of the COVID-19, so everybody are very concerned about this. So they are not allowing the student. Whatever, I believe COVID in history right now. We are very close to say goodbye, but still there are so many cases. We have so many, company, or we have a collaboration work with some hospital where our students go. Some of them allowed and some of them not allowed because of the still the COVID issues. So whatever it is, my friend, students have a curiosity about the clinical side. And I said, we have an agreement with the clinical side. We make it for you. And beside of this, about the simulation lab is more than enough for the clinic, more than enough than clinical side. When you go to the hospital, they are not allowing to touch your patient, to go through the procedure, how to push the IV insulin, intramuscular insulin, intramuscular injection, sub-Q injection, insulin mixturing. They are not allowing you because you are a student. But in simulation lab, you can do it in person, you can do practically. So you will learn more in simulation lab rather than the clinical side. But clinical side is a type of satisfaction. So we will provide it. So 2 weeks for clinical, right? And I said this week, the last week, then we will send you for 2 more weeks for community nursing and leadership. Both is important for NCLEX board. Any student have any kind of question? Hope so, no. So let me see. Some student write some question. I want to read it. Okay, a student write a question. What color for the uniform for clinical? Definitely white color, white, because the student always wear white uniform. Okay. And another student write, when does the leadership class start? Usually we forward you the email. You have to check your email for leadership. And by this time, I will talk to the school. When we organized, we will let you know over email. So you can keep eye open for your email. But it is important that you have to know this is the week we're going to finish, no more. And you see, last week, one of the final exam, this final exam quiz, I will send you the link today before finish the class. Okay. So next, like here, according to this schedule, next Monday, we do not have, or next week, we do not have any class. But you have to wait until you will be get enrollment in the next group for more 2 weeks. And this is final week for you. Usually what we do after when we finish the course with one faculty, we will give the rest 1 week to the student. And this 1 week student actually study by themselves. They can practice the question and get an energy for next level. What is next level? 2 weeks clinical, 2 weeks nursing leadership, and community health. Another student write, when does the leadership cluster? Okay, I said usually we, after finish the class, we give 1 week rest. Then after 1 week, we will email to the student for this. Okay, can we choose a hospital to go to? No, you do not choose. You do not. So Lucia wrote this question. Usually we have a agreement with few hospital or rehab center or clinic. We decide who will go where. But also the reason being, because the COVID pandemic, there's some limitation. Every hospital not allowing us. This is the reason last 2 years our students go to the our own simulation lab and they are passing. The good point is here, our student is passing all the time. And this is our this help us to go forward. And the student wrote, what does an hour are for the clinical? So what dates and hour for the clinical? Very good question. So basically, the clinical hour, let me write it here for you. So she wrote the date and hour, okay, for clinical. First of all, let me say about the hour. Usually the hours start from 8 a.m. to 5 p.m. Usually, or 10 a.m. to 5 p.m. So this is 2 times, or 10 a.m. to 5 p.m. This is the hour. And what about the date? Students are very confused about the date because they do not know, and it is very natural. The date is not fixed. Why? Because our students sometimes participate from a distance. So date is not fixed for all the students because most of the students has a job. You have to adjust. You have to talk to your, organization where you work, right? Imagine a student named Jane. Jane, make a time to come this week. Okay. When he or she comes this week, we give him or her 2 weeks rotation. Your friend named Lucia, she want to come after 2 weeks. So when she make the time, it will be count when she will be in our school. Again, it will become for 2 weeks. So basically, in school, when you come physically, they will give you the schedule. They will give you the time and table, what you should do, where you should go. And also, I like to request you, our school CEO, Mr. Voltaire, and also Miss Miggy can give you more information about that. So if any student need their contact details, or Dr. Pierre also can help us. So you can contact with him or them, right? But it is nothing rocket science. It is very easy. And other things is we are very flexible. We don't like to hold the student. We like always push them and prepare them and help them to get eligibilities for licensing exam. Because sooner or later, you need the license, right? So why not today we try to go forward? I know there are so many obstacles, and it is natural. It is the rules and regulation you have to follow. Otherwise, everybody should go and sit for the licensing exam. Why not everybody going? Because the school system in US, the system is very restricted. I believe, it is my opinion. Licensing exam is far easy to complete a program from a good school, accredited school, licensed school. Okay, this is a system again, I said. You can't overlap this system. You can't break down the discipline. And we do not allow it to. So date is not fixed. When you're ready, you talk to the school authorities. They will give all details. Next, what question you write? Okay, so okay, one original. Okay, another student wrote, I'm okay, so okay, so next go. Next questions here. What day is the final exam posted? Okay, Nadia, you write what date final exam. I will post it by today. Okay, if anything is happened by this Friday, I will send you the final exam. But this is the final exam for the subject. It is not the exit exam. Okay, it is the final exam for the subject. So another student writes, I live in south of Miami Garden. I was just wondering if there was a site close to my location or if was focused around Miami Garden area. To be honest with you, we have a limited clinical site. You will come to the school and school have a own vehicle or school has a own transportation with a school logo. They will drive you to bring the clinical site. But again, I'm just don't forget this, because of the COVID, there's so many sites are not allowing to take the student. Alternative is we have a simulation lab. In the simulation lab, students also learn how to mixturing different kind of insulin, how to push IV, sub-Q injection, how to bed making, and how to calculate dose and uh, drug calculation, how to measure the IV, and also how to measure the vital sign, and what are the interpretation of EKG. So all of this you can learn from our simulation lab. So don't worry about this. We can make it for you. Okay, so here, yes, but I will try to send you the final exam link today if anything happen before Friday, because it is not only my decision. We work as a team. So it is a teamwork, and also the IT people work with it. So I will talk to the IT. I will, if anything is missing, I will request him to send it to me, and I will forward it to you. Another student wrote, can I do clinical Friday, Saturday, Sunday? As I was told in the beginning, I live in PA, okay, Pennsylvania. So about it, I want to tell you, you can text to the our CEO, or you can text me. I will forward it to them. But usually you have to take off from your job to come here. Okay, but only Friday, Saturday is not possible. Hope so. But you can text me. We will think. I'm not promised with you right now. And Lucy, I thought, okay, so okay, so good morning. After we meet the requirements, when will we take? Okay, my friend, a student write a very good question. She wrote, after we meet all requirements, when we will take the exit exam. When you meet all of the requirements, then it's up to you when you will sit for the exit exam. What does it mean? Like today, you meet all of the requirements. Then I can give you time tomorrow. But tomorrow you are not ready. So when you meet all of the requirements, then you decide when you will come for the exit exam. It is not that much hard, because students finish the requirements, then they think, oh, I need to sit for the exit exam. Let me open the book. Then they take 2 months. So always I like to request, beside this lecture or training, try the exit exam practice question. Where you get the practice question? Every day in my class, 1 hour, I discuss the practice question. And that practice question I left in Evaluation Health Academy channel, YouTube channel. Also, I like to request you practice question from Evolve online 4,000 question. All questions come from there. And you have to get 75% from there. Next, another student wrote, when the exit exam will be available to us. Exit exam, you have to contact the school. Exit exam is not like the other exam. It is little bit different. You have to talk to the school CEO. We will give you time, particular time. Then in particular time, you have to sit for the exit exam. It is not like the as usual other exam. But the question is easy, and all questions come from the practice question, what we do every day, and also from Evolve. Evolve is the online 4,000 questions. And the student write, does the exit exam have to be done at the school. Yes. Yes, let me read again what she wrote and what is my answer. She wrote, does the exit exam have to be done at the school? Answer is yes. And Justin, you wrote, is the exit exam will be taken at the school in our, or no, not in your house. It should be the school. When you come in the exit exam, for the clinical, in the same sitting, you can sit. Okay, so no problem. If you have any more question, please don't forget to ask me. I'm happy to assist you, answer all of the questions. So that one. A student write another question. When do we get our 1090 form? So this is for the tax. Some of the students maybe need it. So for this tax form, you can contact to the Mr. Pierre or Miss Maggie or even CEO. You can text him, we will answer you. Because this is the another defined text from 1090. I'm not the good person to answer this one, but they can help you. So next, go. So according to the our schedule, today it is 07 to 07, maternity and newborn medication. And test yourself in maternity evolve as a preliminary exam, right? So let me review. And also they said summit review videos also we will do. Let me explain medication, what we use in maternity unit.